In the mid-2010s, the rural town of Valley View, Nebraska, faced a crisis that threatened its very existence. The local hospital, a modest 30-bed facility that had served the community for over 80 years, was on the verge of closure. Years of declining population, rising medical costs, and insufficient insurance reimbursements had drained its finances. Doctors were leaving. Equipment was outdated. And with the nearest alternative hospital over 70 miles away, the closure would have been catastrophic. For elderly residents, emergency care would become a death sentence. For young families, it would be one more reason to move away. The town's mayor called it the beginning of the end. But then, unexpectedly, help came from Omaha. Warren Buffett, who had long maintained deep connection to rural Nebraska despite his global success, learned about the hospital's plight through a letter from a retired teacher who had once taught him in 4th grade. Though they hadn't spoken in decades, she wrote with urgency, "This town gave you your start. Now it's asking for yours." Buffett didn't respond with a check. He responded with a plan. He didn't believe in simply writing checks to keep failing institutions alive. He believed in sustainability. So he called a meeting not with Wall Street analysts, but with local leaders, doctors, and administrators. Over several months, he worked behind the scenes to restructure the hospital's financial model. Through Berkshire Hathaway's network, he connected the hospital with low-cost medical suppliers, arranged discounted insurance rates, and facilitated a partnership with a regional medical university to bring in rotating residents and reduce staffing costs. But the most transformative move came when he convinced a group of Midwest-based companies, including several Berkshire-owned businesses, to collectively fund a 5-year operating grant. This wasn't charity, it was a commitment to community health as economic infrastructure. Buffett also launched a public awareness campaign, not under his name, but under the slogan, "A town without a hospital is a town without a future." He didn't appear in the ads. He didn't give interviews. But the message spread, and donations poured in from former residents, local businesses, and even strangers moved by the story. Within a year, the hospital was stabilized. It upgraded its emergency room, installed telemedicine equipment, and reopened its maternity ward. More importantly, it became a model for rural healthcare sustainability, studied by policymakers and featured in public health journals. For the people of Valley View, the reopening wasn't just medical, it was emotional. The hospital had been where babies were born, where veterans received care, where generations had said their final goodbyes. And now it would stay. Years later, the hospital installed a small plaque near the entrance, "Saved by the community," supported by a son of Nebraska. No name was mentioned, but everyone knew. For Buffett, this wasn't about ego or legacy. It was about reciprocity. He had built his fortune on simple principles, honesty, patience, and belief in long-term value. And he believed that small towns were the foundation of American strength. He often said that his success wasn't due to genius, but to luck, being born in the right place at the right time with the right opportunities. So when he could, he paid that luck forward. And for Valley View, that payment wasn't in billions, it was in survival. Because for all the stock ticks and billion-dollar deals, Warren Buffett's greatest investment may have been in the idea that no community should be written off, especially not the kind of place where a young boy once bought his first stock and dreamed of becoming something more. And sometimes, saving a hospital isn't just about medicine, it's about keeping a dream alive.